Today, state health officials addressing concern as we head into winter, and it's not just COVID, it's other viruses too. Fox 13's Frankie Thompson has been following this latest discussion from the Department of Health. Frankie, what do we need to know?
Health officials say we should still be mindful of COVID-19 in addition to other respiratory viruses spreading this season that could challenge our hospitals in a way we haven't seen.
The State Department of Health says Washington is currently seeing a moderate rate of COVID-19 infections. Though the pandemic was declared over, there's still uncertainty about what's on the horizon.
We don't have a way of predicting COVID-19 activity, but we need to prepare for the likelihood of another wave of COVID-19 this winter. In fact, some European countries have seen a rise in cases in the last few weeks, and the same could happen here in the United States.
As more people gather indoors this season, DOH officials say the transmission of COVID is likely, and so are other infections causing concern, like respiratory syncytial virus, known as RSV. Health experts say the virus is spreading rapidly across the nation and here in Washington. Its symptoms mimic a common cold that people can easily treat, but it can be very severe for those with compromised immune systems, elderly, and babies.
We're hearing that most pediatric sites, such as Seattle Children's Hospital and Mary Bridge Children's Hospital, are seeing record high emergency department volumes due to RSV and other respiratory viruses.
The high volume of RSV cases is putting even more strain on the overwhelmed healthcare systems still dealing with the effects of COVID-19, not to mention the looming worry of this year's flu season.
This may be the first season in a couple where we're not going to see as much masking happening across the system, and that is the concern that we may see more of those respiratory diseases and the transmission that goes along with them.
State health leaders say reducing the spread of these respiratory diseases comes from population immunity. Though there is only treatment for RSV, they're urging all eligible people to get their flu shot and updated COVID-19 booster.
It's more important now than ever to make sure your home's vaccination status is up to date, whether that means making sure younger children have completed their primary series, or anyone in your family who's eligible has received an updated bivalent booster.
By vaccinating, DOH says it could help ease some of the burden at stressed healthcare facilities.
This is going to be a challenging time for the next few months, and let's hope that by the time spring comes back around and the weather gets better, that we will be in a better place. But of course, we can't guarantee that because this is potentially, as I said, the new normal that we may be seeing for some time.
The Department of Health says face masks will still be required for all healthcare and long-term care facilities. COVID vaccination requirements for health and education workers will end Monday, which marks the end of the remaining COVID-19 orders and state of emergency in Washington. But the governor says employers can continue requiring vaccines if they choose. Back to you.
All right.